All right. Good morning, everyone. My name is Chris Paulson, and I am a regional director for GoldenCare, if you don't know me already. And I would like to thank you all for your time today, and I hope you enjoy the presentation. It's a pretty short webinar, and it will be recorded on our website at goldencareagent.com. You'll notice, excuse me, let me back up here. There we go. Sorry about that. You'll notice on the screen there both our phone number for our marketing team as well as an email that you can reach our inbox, as well as you can go to our website there, goldencareagent.com. We are always happy to help. All right, and like I said, if you've not visited our website, I would highly recommend that you do so. As you can see on the screen, why GoldenCare? We offer lots of value-added services that can really make a difference and assist agents in increasing their sales and generating leads. We really like care options, which helps agents and clients alike, as well as LTC CEO for agents that are in the long-term care arena. Also, our perfect portfolio has a little something for everybody. So for more information, please go to goldencareagent.com, or again, you can call us at 1-800-842-7799. All right, so today we are going to be discussing GTL, Guaranteed Trust Life, short-term home healthcare product. It is a very easy it's a very easy product to get your clients qualified for, as it's almost nearly guaranteed issue. It gives them flexibility in that you can build an inexpensive yet valuable plan for your client, or you can you can load up the policy and provide extra benefits and riders to maximize the effectiveness of the policy. Really great product. So we'll tell you a little bit more about it here coming up shortly. So I'll tell you a little bit about our agenda today. We are going to review the niche of the product, some of the details of the plan, show you some rates as well, and I'll also go over just how easy it is to get your client qualified for GTL's short-term home health care. Now, a little bit about GTL. Guaranteed Trust Life is the full name of the company, but they're better known as GTL. They are a great company and one of our major partners here at GoldenCare. They have been around for a long time, over 80 years in fact, and we have worked with them side by side for quite a few years and helped a lot of people, sold a lot of policies in the process. So we value their partnership. They are headquartered outside of Chicago in Glenville, Illinois, and they have recently been upgraded to an A- rating with AM Best. And that's particularly impressive because most insurance companies, they need a large life block of business in order to achieve that rating, something of which GTL cannot claim. So that speaks to the financial security and just how strong the company is overall. Now, the company offers more than just short-term home healthcare. Obviously, we're going to be, focusing on that today. But these are some of the other supplemental products that they do offer, including critical cash, which is one of our more popular products with our clients and our agents. And we'll touch a little bit more on that later. They have a great suite of products that can provide some real benefit and value for your clients. But as I said, today we're going to focus on the standalone home healthcare product to help keep your clients out of the nursing home. So of course, like anything, your clients are going to ask you, why am I going to choose this policy over a competitor or a different product? Well, here are some of the reasons. The issue ages are 61 to 85. The benefits can pay up to $450 per day for a benefit period of up to 360 days. It says or less there as well. It could be shorter, could be longer, just depends on several different factors. We'll go over those. The benefits are paid regardless the benefits are paid to the client regardless of whether they have any other insurances that may be paying them. It's completely irrelevant. They pay if the benefits are triggered. So nearly every person between the ages of 61 to 85 will be able to qualify for this product. There are only 2 or 3 health questions depending on the plan that you pick. The first one being, are you currently in a nursing home or assisted living facility? Or number 2, are you unable to perform 2 of the 6 daily average living activities, or are you cognitively impaired? If the answer to both those questions are no, they qualify. And then there's a third question that goes, do you expect a hospital stay, a nursing home, assisted living, or a surgery are any of those things in the client's future in the next 60 days? That would only apply to the more robust Plan C that offers the most benefits. So if they're taking Plan A or Plan B, obviously that would not apply. If they want to go with the full benefits, they would have to answer all three. Now, one of the nicer features of this product is the home health aide, right? Somebody that's in the house that can provide some services aside from, with just some services at home, both medical and maybe non-medical. This product pays up to $120 per day to help assist with daily living activities like bathing, dressing, okay, for up to 60 service days. Okay, so they're able to take advantage of that. Not a lot of products offer home health aides, so that's a nice benefit that GTL offers. There also is a unique built-in prescription drug benefit that can help offset the cost of the plan, up to $600 per year. In fact, it depends on which plan that they choose. The plan also includes restoration of benefits. So earlier I hinted that the plan might be able to go longer than the 360-day benefit period. Just depends on if the benefits were able to restore. I'll go into a little bit more detail later. There are strong riders as well that are available for this plan that include hospitalization, critical accident, ambulance, return of premium, dental and vision riders are also available with short-term home health care, depending on the state that your client lives in. Now, how do you trigger the policy? It's similar to long-term care. The plan triggers the benefits in that if the client is not able to perform at least 2 of the 6 average daily living activities, or ADLs as they're better known, such as bathing, eating, toileting, dressing, continence, and transferring. If they are not able to do at least 2 of those 6 activities without substantial assistance, with either hands-on or standby assistance, that would trigger the benefits. Or if they suffer from a cognitive impairment, including Alzheimer's and dementia, that also would trigger the benefits here. So, and remember, this is an indemnity product. If the benefits are triggered, then the client is paid cash, obviously. The difference between the long-term care trigger compared to GTL short-term home health care trigger here, when I say trigger, I mean what would make the benefits be paid out by the policy, obviously. I'm going to be clear. There is no 90-day requirement. So you don't, with long-term care, if you don't know, you have to be able to prove that they can't do at least 2 of those 6 ADLs for a period of 90 days and require assistance to do that. A doctor signs off on that, and then basically the benefits would kick in on a long-term care plan. That's separate here and different in that you don't need that 90-day period. So that's another benefit. So if your client can't get long-term care, this is a great pivot product to do, or to look at, obviously, for your client, because it doesn't have the same requirements for underwriting or this 90-day expectation. You can trigger the policy for, let's say, 3, 4, or 5 weeks, and if you get better and stop receiving benefits, the plan will restore your benefits after 180 days without receiving said benefits. This is a great benefit, keep saying that word, and something that is attractive to short-term clients. Now let's go into a little bit more details about the plan itself. Okay, so the base plan, that refers to the home health care benefits, and it's broken into 3 separate plans. Plan A, which will pay up to $150 in services, or $54,000 per year. Or we have Plan B, which will pay up to $300 per day, or $108,000 per year maximum. And then we have the more robust Plan C, which would require the third health question to be answered, which will pay up to a maximum of $450 per day at $162,000 per year maximum. Now, when I say these numbers, they're cumulative. All the services that you see on the screen that we'll talk about, they are cumulative. They cannot add up to more than those numbers on the bottom, depending on the plan you pick. So, for example, if someone they had Plan A and they had skilled nursing care out for the day, and they also had physical therapy, that's $150 for that is going to be paid out. Any other services that are used are going to be out of pocket, and the company will not cover those, as the maximum benefits have been triggered for the day, if that makes sense. So the maximum benefit period is 360 days, and that is service days, not calendar days. Important to know the difference. So if you receive care only a few times a week, let's say, this plan will obviously last longer than a year should your situation need it. And you can see the table referring to the services offered. So for example, as we talked about, if you have the $300 per day plan B, if you had a physical therapist and a skilled nurse come in, that would be your $300 in benefits for the day. Anything else beyond that would be out of pocket. And some of the services that are offered, as you can see here, are general nursing, general and skilled nursing care, RN, LPN, or LVN, therapy such as physical, occupational, and speech, chemotherapy as well as there's a medical social services benefit, and that refers to, essentially in layman's terms, a care coordinator, and someone that will set up a plan of care for the client and will usually check in on that plan set fairly regularly to make sure that everything's going according to plan, is going smoothly. So another great benefit that GTL short-term care plan offers, and I think that your clients will find very beneficial. So the home health aid, that it's a little bit different. So depending on the plan you pick, it pays out different benefits. There's a $40 per day for plan A, or a maximum of $2,400 per year. Plan B obviously is $80 per day, or a maximum of $4,800 per year or benefit period. And for plan C, that $120 per day, or a maximum of $7,200. Like I said, it's a really nice benefit because it's above and beyond the base plan. So this what you see here is not included in the 150, 300, or $450 per day. This is above and beyond that number. So that's an extra service that's nice that you're able to take advantage of, your clients are, I should say. Now, you also see that there's no prior hospitalization that is required. Some companies that offer the home health aid benefit, they require that. GTL can claim, that we do not. So that's a really nice benefit that sets us apart from some of our competitors. And remember, the 60 days, this benefit is service days, not calendar days. So it's not going to run out in 2 calendar months necessarily. It could last longer than that. So that's a nice benefit there, period. But it is a maximum of 60 days, just so you know, for the life of the policy. Now, the built-in prescription benefit, another great feature of this product is this prescription drug benefit. The way that it works is your client can receive up to $300 per year back to them for plan A or plan B if they chose, or if they did the more robust plan C, they would have a maximum of $600 in prescription drug benefits that they would be able to receive back to them. And the way that it works is basically for every generic medication that your client receives, they would get a $10 basically credit from the company that would pay back to the client that they can use to help pay for premiums or whatever else they want. And for generic, or excuse me, it's $10 for generics, it's $25 for brand name drugs. And every time that they refill the prescription, it will count as a new prescription. So if you have a client that takes a good amount of medications, it can significantly lower the plan costs and potentially even pay for the plan itself. All right, now restoration of benefits. So we talked about it could go a little bit longer than a year. It's a 360-day benefit period, but benefits can restore. The way that it works is if the client has not received covered services for 180 consecutive days, and a licensed healthcare practitioner certifies that the policyholder has recovered from their ailment sufficiently and no longer needs skilled nursing or home health care services, they would be able to use these benefits again. It's not like there's a bucket of cash that is built in there necessarily. Um, the policy can be restored an unlimited amount of times. This is referring to the base home health care as well as the home health aid benefit. Riders and prescription drug benefits restore annually, or they have their own maximum lifetime benefit limits that are separate from the base benefits or the home health aid benefits. And remember, unlike long-term care plans, which require a 90-day trigger, this product does not need that same requirement. So you could see more smaller claims than you would with a traditional LTC plan. So I spoke about the riders. I'll go into detail a little bit here. So obviously the product offers some really nice benefits, including some of the riders that are added. And I'll talk about those here. So recently, due to the coronavirus, um, accident and sickness, these hospitalization type riders, they've become a little more popular because, let's be frank, people have been in the hospital more than we'd care for, right? They've been getting sick, and unfortunately, they've been having to be seen, for overnight stays in the hospital sometimes. So this particular rider has become popular, and it pays between $100 and $300 per day, depending on the plan that they chose, Plan A, Plan B, or Plan C, as you can see there on the screen. And for the benefit periods of 3 days or 6 days if your client's hospitalized. With so many people being affected and ended up in the hospital, as we spoke about, a lot of people are aware that this is a possibility, and this rider can help protect them and give them peace of mind from the full cost of an inpatient stay that may be 24 hours or longer. Those stays can really be expensive depending on their coverage. So it's good to have this peace of mind. So some of these riders have become a little more popular, and GTL's has a little more success, attaching these to some of the policies. Another key point about this rider is that it pays cash regardless of if another insurance is paying. The cash is the client's to use as they please. The critical accident rider, this is for people that are more susceptible to slips and falls or already suffer from, let's say, bad knees or hips, let's say. This can help the client as it pays lump sum payments after they have been to the emergency room or urgent care facility related to that injury. Accidental death benefit is also built in. The client can choose either a $5,000 or a $10,000 benefit. And obviously for people who just need to protect themselves, this is a great way to give them a little bit of peace of mind, and added on top of the short-term care plan. And make sure that you check the state that you're working in, as there are some state requirements and limitations. Also important to know that this particular rider does not offer a restoration of benefits. The optional ambulance rider pays $200 per trip, and it can be used up to 4 times per year. It does not require hospitalization. The lifetime maximum payout for this benefit is $2,500 with no restoration. So once the $2,500 benefit has been used, the rider is no longer available. The premium load is fairly inexpensive and can add some good value to your clients' plan to make it a little more robust. The return of premium rider works in that if the insured were to pass away before their 86th birthday, their beneficiaries will receive every dollar paid in premiums, subtracting any claims that were paid out to them during the life of the policy. Also, a fairly inexpensive rider from a premium load standpoint. So that's nice. The return of premium rider was originally not available on the plan, but after some feedback and hearing from some agents and some clients, GTL worked with everybody and they added it to the plan. So made the product a little stronger, and we appreciate GTL for working with everybody on that. That was great. For people concerned with return on their investment, this is a great way of easing their mind, giving them, letting them feel like they're going to be able to not only get the benefits, but if they don't, they're able to, get something back for what they've paid in. Pardon me, I'm right next to the highway here, so sometimes we get some emergency vehicles. All right. Now there's a dental and vision rider as well that's attached to the plan if they choose. They can either pick between a $400 and $800 or a $1,200 per year benefit for dental and vision services. That pays a calendar year deductible and has limited benefits in the first year, usually one half of the maximum benefits above. Eyewear, eye exams, and dental cleanings have caps on how much they pay, and benefits are paid regardless of any other insurances being paid. So you're hearing that, frequently here. So that's a nice benefit that GTL offers here. That if there's another insurance, sometimes they just won't pay if there's another, you know, insurance that's primary and then they're going to be secondary. We don't have to play that game. They just pay out if the benefits are triggered. That's simple. Some more benefits on the dental. States vary on the initial waiting period for some of the dental periods, so make sure that you pay attention to that. Same principle applies to the vision benefits requiring a waiting period for individual services. So make sure you make note of that if your clients are interested in this benefit, or in this rider, I should say. And the dental and vision benefits, those do in fact restore every single year. Now, on a lot of the products that GTL offers, one of the nicer benefits that that a client can use is called the Ask Mayo Clinic benefit. It's a free service to them. Essentially, it is a 24-hour nurse line with nurses averaging 24 years of experience. It's an online, on-demand service that can help clients assess any symptoms that they may be experiencing. It's done anonymously. There's also a critical illness support team with cancer, heart attack, and stroke experts that are available to assist in this extremely scary time. So if somebody's not feeling good, they have this product, they can reach out, and they have somebody, direct access to somebody that could potentially save their life or really be of great service to them, great help. You can see, and probably not a surprise, you can see in the bottom right corner there the customer satisfaction statistics. They speak for themselves. So 98%, that's a big number. So you can bank on the fact that majority of the time you're going to call in and you're going to get a high level of satisfaction. And most of the time they're not calling for something minor. This is somebody that's going through potentially something very serious. So to have that, it's just another way that GTL offers peace of mind to clients for short-term home health care. As of today, the product is offered or available in 35 states in the US plus the District of Columbia. So there's a good chance that it's available where your clients are. And if it is, this product is a great option for your clients, especially if they take medications with that prescription drug benefit. Hopefully there's going to be more states approving this product in the near future. All right, let's talk about some rates. To figure out pricing, it's easy. There is a pricing worksheet, so you would use that, which is age rated. So if you're age 62, excuse me, let me go back. So if you're age 62, here's your cost, plus if there are any riders. Add those together and there's your price. Just basically add the math on the sheet. It's very easy to do. If you call our office or email us at our marketing team at marketing@goldencare.com, or excuse me, marketing@goldencareusa.com, we can provide you with pricing worksheets or any other materials for the product here. Apologies on the emergency vehicles again. This product is age banded, and what I mean by that is every 5 years the client will go up to the next age bracket, so that their premiums don't go up every year. They would increase every 5 years. Now let's talk about these rates. So an example, you can, like a lot of products, you can build a product or a policy, an illustration that, you know, is very affordable for your clients, right? Or we can go more robust. So let's look at on the cheaper side. So we have a female age 61. As the example on the left shows just how affordable this plan can be. For, excuse me, for only $253 per year, your client could get Plan A with up to $150 per day for home health care services and $40 a day for a home health aide to help with daily living activities. Plus, they could receive up to $300 in total prescription drug benefits. So they literally could get paid to have this plan. I'm being serious. How many home health care products can say that? Probably not many. And this is the big reason why we're selling so much of it. You can also load the plan up and make it a very robust policy for your client. If they chose Plan C, which would provide your client with up to $450 per day worth of benefits, with a $162,000 base benefit maximum, $120 per day for a home health aide, and up to $600 back to your client maximum for their medications that they take. The prescription drug benefit could, in this example, cut the premium by over 30% if it were to be maxed out. So this example also includes several riders bundled. So you can see that this plan can provide a lot of value for not a lot of money. Now, GTL offers several other products. So let's say that you wanted to bundle two together and sell a comprehensive solution. Well, if we offer GTL's critical cash, which is their critical illness policy that in some states offers facility benefits as well, so it can mimic a long-term care plan. So it's a lump sum critical illness plan, and upon diagnosis of a covered critical illness like a heart attack, stroke, or cancer, your client would choose a monthly benefit, and they would either be paid out a one-time lump sum payout of the full benefits, or they can be paid out monthly. And you can see some of the benefits of critical cash on the left. Very good plan for $130 a month, as you can see. As well as they can use it over and over until the maximum benefits have been used. And let's say you paired it with short-term care. You're able to offer a comprehensive solution that will take care of several other needs. And they don't need to worry about critical illness coverage, and they wouldn't need to worry about home health care coverage. They're able to stay out of the nursing home, give themselves some real peace of mind. And for an extra $53.11 per month, you could get both those plans, pay cash, pay regardless of other insurance, and in combination can provide some really good peace of mind, as I mentioned. Under $200 a month. And here's an example of the rates, as I mentioned. For example, a person aged 61 to 64 would pay between $19.42 for Plan A and $43.44 per month for Plan C with no riders. It's really easy to see and price. It's really easy to price this, and simply matching their age to the corresponding price on the chart, add any riders that are necessary or applicable, and there's the rate for the client. So easy to price, easy to get them qualified for the plan, easy to pay for, with the benefit that actually has some real life value and can keep them at home and out of these facilities that they don't want to go to anyway. The product is, as you can tell, a really great option for a lot of your clients who just either don't want long-term care, can't get it, or just simply want to focus on staying at home and get themselves a shorter term plan. It's a great option. All right, so that's our presentation for the day. I'd like to thank everyone again for taking time out of your busy schedules to join me and my team. We really appreciate it. Again, my name is Chris Paulson, and if you have any questions about GTL short-term home healthcare or any other product that they offer, or any of our carriers and products, we would love to hear from you. So please feel free to call us at 1-800-842-7799. You can email us at marketing@goldencareusa.com, or visit our website at GoldenCareAgent.com. It was a pleasure being with you all today, and I hope that you have a great rest of your week. Bye for now.
Check out our website, GoldenCareAgent.com, or give us a call at 800-842-7799.